17 Signs of Heart Problems. How to recognize early and advanced symptoms of heart attack. A silent threat. Are heart problems dangerous? What do you feel when you have heart problems? What are the 17 warning signs of a heart attack that indicate a serious situation? And what can be done to prevent heart problems before it's too late? Today, I will discuss heart problems, a condition rapidly increasing worldwide. In the 90s, heart diseases were less frequent. Today, they are more common than you think and are affecting even young people. In the United States, over 30% of adults have some type of heart disease. Do not think it is a simple condition. If untreated, heart problems can lead to serious complications like heart failure, arrhythmias, and even sudden death. We will discuss how to recognize the early and advanced signs of heart problems, a silent threat that can catch many by surprise. I will explain each of the 17 warning signs of a heart attack, highlighting the importance of acting quickly to protect your health. Heart diseases are the leading cause of death worldwide. Every year, millions of people are diagnosed with some type of heart problem. This includes everything from high blood pressure and arrhythmias to heart failure and heart attacks. It is a condition that does not discriminate, affecting men and women of all ages and ethnicities. The increase in obesity rates, diabetes, and sedentary lifestyles has significantly contributed to this growing problem. The heart is the organ that pumps blood throughout the body, providing oxygen and essential nutrients to cells. When the heart does not function properly, the whole body suffers. Heart problems can lead to serious complications like heart failure, where the heart cannot pump enough blood to meet the body's needs, and arrhythmias, which are irregular heart rhythms that can be fatal. Furthermore, atherosclerosis, the buildup of plaque in the arteries, can lead to heart attacks and strokes. Can the heart regenerate? The heart is a vital organ, but it has a limited ability to regenerate. This means that once damage occurs, it is difficult to reverse it completely. However, detecting heart problems early can help prevent further damage and improve quality of life. Lifestyle changes, medications, and, in some cases, medical procedures can help control the condition and improve heart health. Let's talk about 6 early symptoms and 11 more serious complications that indicate heart problems, emphasizing the urgent need for care. Knowing these signs can save lives, including yours. Early symptoms. First early symptom, chest pain. Chest pain, also known as angina, is one of the most common symptoms of heart problems. It can be a squeezing pain or a feeling of pressure in the chest. Often, the pain radiates to the left arm, neck, jaw, or back. This pain usually occurs because the heart is not getting enough oxygen due to blocked coronary arteries. It is a clear sign that something is wrong and should be investigated immediately. Second early symptom, fatigue. Extreme fatigue, especially after light physical activities, can be a sign that the heart is not pumping blood efficiently. People with heart problems often report feeling exhausted for no apparent reason. This happens because the heart needs to work harder to pump blood through blocked or narrowed arteries, which requires more energy from the body and causes a feeling of tiredness. Third early symptom, shortness of breath. Feeling short of breath, especially during physical activities or even at rest, can indicate heart problems. This happens because the heart is not able to pump enough blood to the lungs, which reduces the amount of oxygen available to the body. Shortness of breath can be accompanied by a feeling of tightness in the chest and should be evaluated by a doctor. Fourth early symptom, palpitations. A sensation of rapid, strong, or irregular heartbeats, also known as palpitations, can be a sign of arrhythmias. Arrhythmias are irregular heart rhythms that can be dangerous and lead to serious complications, such as stroke or heart failure. If you feel frequent or intense palpitations, consult a doctor for a thorough evaluation. Fifth early symptom, dizziness and fainting. Dizziness or fainting can occur due to reduced blood flow to the brain, a problem that can be caused by various heart conditions, including arrhythmias and heart failure. If you experience these symptoms, it is crucial to seek immediate medical help to determine the underlying cause and prevent serious complications. Sixth early symptom, swelling in the feet and ankles. Swelling in the feet and ankles can be a sign that the heart is not pumping blood efficiently, leading to fluid buildup in the body. This swelling, known as edema, can be an indication of heart failure, a condition where the heart cannot meet the body's needs. Advanced symptoms. First advanced symptom, severe chest pain, unstable angina. If chest pain becomes more frequent, severe, and prolonged, it may indicate unstable angina, a precursor to a heart attack. This pain usually occurs at rest and does not improve with medication or rest. It is a medical emergency that requires immediate attention. Second advanced symptom, severe shortness of breath. Shortness of breath that suddenly worsens and becomes severe may indicate acute heart failure or pulmonary edema, where fluid accumulates in the lungs. This is a sign that the heart is failing and needs immediate medical intervention. Third advanced symptom, cold sweats and nausea. Cold sweats and sudden nausea can be signs of a heart attack. Many people ignore these symptoms, associating them with digestive problems, but it is important to recognize that they may be heart-related, especially if accompanied by chest pain. Fourth advanced symptom, severe irregular heartbeat. Extremely rapid or slow heartbeats, or prolonged episodes of irregular rhythms, can be signs of severe arrhythmias that need medical attention. Arrhythmias such as atrial fibrillation or ventricular tachycardia can be fatal if untreated. Fifth advanced symptom, frequent fainting. Frequent fainting or syncope, especially those that occur during physical activity or in situations of emotional stress, can be signs of serious problems in the heart's electrical system, such as heart block or arrhythmias. Sixth advanced symptom, radiating pain. Pain that radiates from the chest to other parts of the body, such as the shoulders, arms, especially the left, back, neck, or jaw, can indicate a heart attack. This pain can be constant or intermittent and should not be ignored. Seventh advanced symptom, extreme fatigue and weakness. Extreme fatigue and weakness that make it difficult to perform daily tasks can be signs of advanced heart failure. This occurs because the heart is not pumping enough blood to meet the body's needs. Eighth advanced symptom, generalized swelling, edema. Swelling that extends beyond the feet and ankles to the legs, abdomen, and other parts of the body can be a sign of advanced heart failure. This generalized swelling indicates that the body is retaining fluids due to the heart's inability to pump efficiently. Ninth advanced symptom, persistent cough or wheezing. Persistent cough, especially one that produces white or pink mucus, or wheezing when breathing, can be a sign of heart failure or pulmonary edema. This occurs because fluid accumulates in the lungs, making it difficult to breathe. 10th advanced symptom, loss of appetite and nausea. Loss of appetite, nausea, or a feeling of fullness can occur due to abdominal swelling caused by heart failure. These symptoms are often underestimated, but they can indicate an underlying heart problem. 11th advanced symptom, mental confusion. Mental confusion or difficulty concentrating can be a sign that the heart is not pumping blood adequately to the brain. This is common in people with advanced heart failure and requires urgent medical evaluation. Diagnosis and risk factors. How to discover if you have heart problems. The diagnosis of heart problems usually involves a combination of physical exams, blood tests, electrocardiograms, ECG, echocardiograms, and stress tests. In some cases, coronary angiograms may be necessary to identify blockages in the coronary arteries. It is crucial to detect heart problems early to start appropriate treatment and prevent serious complications. Risk factors. There are several risk factors that increase the likelihood of developing heart problems. Let's discuss some of the main ones. First risk factor, obesity. Obesity significantly increases the risk of developing heart diseases. Excess weight puts extra strain on the heart, forcing it to work harder to pump blood. This can lead to hypertension, diabetes, and elevated cholesterol levels, all factors that contribute to heart problems. Second risk factor, type 2 diabetes. People with type 2 diabetes have a higher risk of developing heart problems due to insulin resistance, which can cause fat buildup in the arteries. This condition, known as atherosclerosis, restricts blood flow and can lead to heart attacks and strokes. Third risk factor, high blood pressure. Hypertension, or high blood pressure, forces the heart to work harder to pump blood, which can weaken the heart muscle over time. High blood pressure also damages the arteries, facilitating the buildup of plaques that can block blood flow to the heart. Fourth risk factor, smoking. Smoking damages the arteries, reduces the amount of oxygen in the blood, and increases blood pressure and heart rate. All these factors put significant stress on the heart and increase the risk of heart attack. Fifth risk factor, sedentary lifestyle. A sedentary lifestyle contributes to obesity, high blood pressure, and elevated cholesterol levels, all risk factors for heart disease. Regular physical activity helps maintain a healthy weight, improves circulation, and strengthens the heart. Sixth risk factor, unhealthy diet. A diet high in saturated fats, sugars, and salt increases the risk of heart disease. These foods contribute to plaque buildup in the arteries, elevate blood pressure, and raise cholesterol levels. Opting for a balanced diet, rich in fruits, vegetables, whole grains, and lean proteins, is essential for heart health. 7th risk factor: family history. If you have a family history of heart disease, your risk is higher. Genetic factors can influence the predisposition to hypertension, diabetes, and high cholesterol. It is important to be aware of this risk and take preventive measures. 8th risk factor: age and gender. As we age, the risk of heart disease increases. Men have a higher risk of heart attacks earlier in life, while women have a higher risk after menopause. Monitoring heart health as we age is crucial. 9th risk factor: stress. Chronic stress can contribute to heart disease. Stress increases blood pressure, cholesterol levels, and can lead to harmful behaviors, such as overeating, smoking, or excessive alcohol consumption. Stress management techniques, such as meditation, exercise, and hobbies, can help reduce this risk. Treatment and prevention. Measures to reverse the condition. Although some heart damage can be permanent, many heart conditions can be managed and even reversed with lifestyle changes, medications, and, in some cases, medical procedures. Here are some preventive and treatment measures. First, avoid excess alcohol. Reducing or avoiding alcohol consumption is essential to protect the heart. Excessive alcohol consumption can lead to hypertension, heart failure, and cardiomyopathy, a disease that affects the heart muscle. Second, exercise regularly. Regular physical activity is crucial for maintaining heart health. Exercises like walking, running, cycling, and swimming help strengthen the heart muscle, improve circulation, and reduce blood pressure. At least 150 minutes of moderate physical activity per week are recommended. Third, maintain a healthy weight. Losing weight, if necessary, can significantly impact heart health. Losing just 5 to 10% of body weight can improve blood pressure, cholesterol levels, and reduce the risk of type 2 diabetes, all factors that benefit the heart. Fourth, adopt a healthy diet. Heart health is closely linked to diet. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help reduce the risk of heart disease. Avoiding processed foods, added sugars, and saturated fats is crucial. Foods to avoid. First, foods high in saturated fats. Foods like red meat, butter, cheese, and full-fat dairy products are high in saturated fats, which can raise cholesterol levels and increase the risk of heart disease. Opt for lean protein sources and low-fat dairy products. Second, added sugars. Excessive sugar consumption can lead to obesity, type 2 diabetes, and heart disease. Avoid sodas, candies, cakes, and other foods high in added sugars. Choose fresh fruits to satisfy your sweet tooth. Third, processed foods. Ultra-processed foods, such as fast foods, snacks, and ready meals, are high in salt, sugar, and unhealthy fats. These foods contribute to hypertension and atherosclerosis, increasing the risk of heart disease. Fourth, excess salt. Excess salt consumption can raise blood pressure, a significant risk factor for heart disease. Reduce salt intake by avoiding processed foods and opting for natural seasonings like herbs and spices. Fifth, fried foods. Fried foods are high in trans fats, which raise bad cholesterol, LDL, and lower good cholesterol, HDL. This contributes to plaque buildup in the arteries and increases the risk of heart attacks. Beneficial foods. First, fruits and vegetables. Fruits and vegetables are rich in fiber, vitamins, and antioxidants, which help protect the heart. Consume a variety of colors to ensure a wide range of nutrients. Fruits like avocado and berries are particularly beneficial. Second, whole grains. Whole grains, such as oats, quinoa, brown rice, and barley, are rich in fiber and help maintain healthy cholesterol and blood sugar levels. They also provide lasting energy and help maintain a healthy weight. Third, fatty fish. Fish like salmon, sardines, and mackerel are rich in omega-3 fatty acids, which reduce inflammation and the risk of heart disease. Consume fatty fish at least twice a week. Fourth, nuts and seeds. Nuts and seeds are rich in healthy fats, fiber, and protein. Almonds, walnuts, chia, and flaxseed are excellent choices that help maintain heart health. Fifth, olive oil. Olive oil is a source of healthy monounsaturated fats, which help reduce bad cholesterol, LDL, and increase good cholesterol, HDL. Use olive oil as your primary cooking oil and in salads. 6th, legumes. Beans, lentils, and other legumes are rich in protein, fiber, and nutrients that help maintain heart health. They also help control blood sugar levels and maintain a healthy weight. Heart problems are a silent threat, but knowing the warning signs can save lives. Recognizing the early and advanced symptoms of a heart attack is crucial for acting quickly and seeking medical help. Lifestyle changes, such as a healthy diet, regular exercise, and avoiding smoking and alcohol, are essential to protect heart health. If you are concerned about your heart health, do not wait. Consult a doctor for a complete evaluation and follow the recommendations to keep your heart healthy. Subscribe to the channel for more health and wellness tips. Thank you for watching. I hope this information is useful to you and your loved ones. Taking care of the heart is taking care of life. See you in the next video.